Hey everyone, and thanks for dialing in today. Welcome to ReThink OT Dailies, 5-minute messages to renew the OT mindset and reignite your passion for the profession. I'm Michelle Eliason, and I'm a neurocentric occupational therapist and the creator of geriatricoccupationaltherapy.com. Let's jump in. Today's topic is group therapy. So what points are we hitting? We're hitting why this topic is relevant, what the OTPF says we should do about it, and what it looks like in practice. Here we go. Number 1, present times. These times are changing. If you haven't been affected by these changes, wonderful. Keep trucking along. If you have been affected in your adult places of service, you know that group therapy in skilled nursing facilities is becoming ever more popular. Every day I see people posting examples of group activities they are doing in their clinics, and it got me thinking, is there a precedent for group therapy among occupational therapists? Is it a free-for-all? Is there a way we can do group therapy and still appear competent while addressing crucial needs that only occupational therapists can address properly? Time to head to the Occupational Therapy Practice Framework. So, number 2, what does the OTPF say about adult group interventions? What is our actual scope of practice or the expectations made on us by our profession? Is there a standard? Yes, absolutely there's a standard. The OTPF says interventions provided to groups and populations are directed to all members collectively rather than individualized to specific people within the group. Practitioners direct their interventions towards current or potentially disabling conditions with the goal of enhancing the health, well-being, and participation of all group members collectively. Does it give examples? Of course it does. When was the last time you read this little beauty? Some of the examples of group therapy include health promotion activities, self-management education, educational services, and environmental modifications. More specifically, it mentions programs like being able to access the internet, falling prevention programs, and learning to coordinate their services in the community. So should we be alarmed and frantic in coming up with arts and crafts projects for adults seeking rehab in order to reintegrate into the community? No. Occupational therapy practitioners are all required to learn how to design group-based programs. There, I said it, programs. Take a breath and consider, what do a group of adults who have recently undergone a surgery, a decline, an injury, a mishap in medicinal management, or any other thing, what can I do to equip them with the tools they need to never end up in front of me again? That, my friend, is the question you need to answer. Number 3, what does this look like in practice? If I was to come up with something at the top of my head for a group occupational therapy session for subacute patients going back into the community, I would break down the number of average weeks the SNF is planning to keep them. Yes, because of all the changes, all SNFs ballpark the number of weeks a patient will be there because they should be planning for how much group therapy they should administer. So say roughly 6 weeks. Psychosocial support and community reintegration preparation, that's your key. Number 1, falls prevention. Number 2, balance exercises and dynamic balance training. Number 3, alternative pain management and the importance of managing pain. 4, planning adventures. Doing one new thing a month that you need to grow with, that you need to adapt to. Number 5, who are you going to call? Teach them the different providers they're going to need for whatever ailment they may be facing. A lot of people don't understand who to go to and therefore impinges on their independence. Number 6, memory loss and action steps. So right there, 6 weeks of programs that you break up into more than one session. All of these areas cause the most dysfunction if not addressed. As for long-term residents requiring group therapy, I would focus on exciting the brain and the body. So stretching, ballistic stretching, not static stretching, sing-along, and anything with gross movement and neurodynamic activity, seating or standing. All of these are important to incorporate in a group therapy session. That's all for today. Thanks for listening. For more information, check out geriatricoccupationaltherapy.com. Talk to you tomorrow.